here again where we want to look at the basic instruments that will found in a tray that a doctor will use on a regular procedure. So any specialty, most specialty that is done, these would be the basic trays that instruments found in the tray. So we have a chart also in the department that tells you basically what to look for, the name of the instruments, how to inspect them, and stuff like that. So I just want to educate you as to it gives you the size, the measurement. So first we have the sponge stick. So this is normally found in every tray, a sponge stick. And it's used to take up sponge. We have scissor, that's a towel clip that is used to hold the garment, or for which surgical site we have the mesenbam, scissors, we have the straight, there's curve, so that's the mesenbam, always in a tray. We have a straight, that's a curved scissors, a straight scissors, and those are used to cut. And we have needle holders. We have a small one, normally Aisley or Cryle or Agard, depending on the size. How do you know? Is by the size of the tips. But this is a regular Cryle. I think that's a 7-inch Cryle. Yeah, so we have different sizes. There's a measurement ruler. I think that one is the 8. Agard, because Agard are the bigger tip, so it goes by when you open to see the tip. The bigger one, Agard. The small, we have the Bobcat, forceps. We have the Kutchner, and those are straight. It's serrated, so that's the Kutchner. And these are clamps or forceps. We open, we inspect to see that there's no bioburden, no blood, no rust, because you got to clean those before sending into surgery. Okay, next to the Kutchner, you have to look at the ratchet, whether it's closing properly. You want a functional instrument to send for surgery, because normally doctors will get upset, but especially if they're in surgery and the instruments are not properly functional. Next, we have a Kelly, and this is a clamp. I also have a picture of the Kelly in this video. Next to the Kelly is a Cryle. That's a smaller version of the Kelly. The Cryle is kind of the same, but it's smaller. You have to open to inspect, as we said before. So mosquitoes are the smaller version of the Cryle. So that's how you're gonna know the difference. So the Cryle is the medium, the Kelly's the longer, and the mosquito are the very small ones. So that's the mosquito forceps or clamp. Moreover, it's a clamp. These are used to clamp vessels or tissues, stuff like that. Now we have forceps. We have the Debilki, and that's a vascular clamp. So if it's a vascular, it's mostly in the vascular. We have the smooth, the teeth, and the Addison. So the forceps with teeth and the smooth, we have the Addison and the Debilki, which are normally in vascular trays. Anything that has to do with vascular system, it's normally there. And I mean, it's in most like basic head and neck. Most of the trays it's found, but it's mostly like a vascular clamp or forceps. Moreover, a forceps. So basically, those instruments are normally found in every tray, a general tray. They mostly use those. So it depends on the specialty that we're in. The more specialized the surgery is, you get forceps, clamps, that is more associated to that specialty. But as for basic, and you have to also for the Addison or any forceps that you're putting, make sure that they close properly, because if they're not closing, so once you hold it, they should be closing. Also for the clamps, it's the same thing. You want to inspect to see that you have proper working instruments. So you have to inspect for chips, cracks, anything that will cause bacteria growth. You have to check for those. Thank you for watching, and I hope you enjoy the content.